When babies are born, a lot of things get done routinely, like being washed and also having vitamin K. And one of the things that's done before discharge is newborn screening. Now, different states will screen for different metabolic diseases, depending on the number of diseases, how common they are in that area, also depending on the state's budget. So we're going to just discuss a few of them. These are some of the common ones: phenylketonuria, galactosemia, hypothyroidism, cystic fibrosis, sickle cell anemia, and there are others depending upon where you live. Hypothyroidism we're actually going to discuss when we talk about endocrine problems, and cystic fibrosis and sickle cell will have their own discussion. So we're going to really just talk about phenylketonuria and galactosemia. It's important with phenylketonuria that this screening test, be done at least 48 hours after birth. If you do it too soon, the baby will not have enough of a protein intake and you will have a false negative. The defect in phenylketonuria is that you cannot metabolize phenylalanine to tyrosine and you build up toxic byproducts. It is picked up on a screening exam. The most common presentation is mental retardation. Babies will also have a musty odor. They may have some eczema, and they also have a presentation that are fair-haired, fair skin, and blue eyes. So look for all of those things when you're reading the stem of the question to lead you towards the answer of phenylketonuria. The best test in that case would be to do your newborn screening. The treatment is to limit dietary intake of phenylalanine, and that should be for life. Mothers who are pregnant need to be very careful because then you can have a baby that's born with problems. Children, as they grow up, since brain development is occurring, you need to really limit their intake. So it is a dietary treatment. Remember that the aspartame that's in the diet drinks, that's phenylalanine. So if you have a patient with PKU, they need to avoid that. The other big one is galactosemia. It's a deficiency of galactose-1-phosphate uridyltransferase. You're probably not going to get asked the enzyme in the question, but you do need to know that you build up toxic metabolites. These babies can have prolonged jaundice. They can have hypoglycemia. Look for cataracts, congenital cataracts that I already mentioned. These babies do not process the galactose, and galactitol actually gets deposited in the lens and causes the opacity. Mental retardation is very common in these patients, even after they've been diagnosed and treated appropriately. And also remember, especially for the exam in the neonate, E. coli sepsis. These babies are at very high risk for E. coli sepsis. This is a contraindication, one of the few ones, for breastfeeding, and they need to go on special formulas. And even though they're treated appropriately, they can still have problems with the mental retardation and developmental delays later on in life.